gastrointestinal drugs, in which we have discussed the few topics such as the proton inhibitors, antacids, and how is the treatment of this gastric or duodenal ulcer takes place. Now, in continuation with that topic, the next is the drug treatment of chronic inflammatory bowel disease. Chronic inflammatory bowel disease. Now, bowel, you know that it is a Latin word, means voluptuous or associates. It is the intestine, having small intestine, large intestine, according to their length. Now, this is the chronic inflammation in the digestive tract, or actually it is the chronic inflammation in the digestive tract. Particularly, it occurs in the intestine, that is in small as well as in large intestine. The colon is the most effective site for this disorder or for this disease condition. The large bowel or the intestine. Colon is the large bowel or the intestine. Now, the chronic inflammatory disease of intestine, also known as Crohn's disease. It is known as Crohn's disease. Now, it causes the ulceration. Now, what is ulceration? Ulceration is nothing but the breakdown of the lining of the stomach intestine of small or large. Both of the intestines will be involved. If there is breakdown of the cells of the lining, particularly the innermost lining of the large intestine is involved. And when there is breakdown of the innermost lining of the large intestine, it may cause the disorder or the disease condition that is known as ulceration. Now, the effects the digestive system from mouth to colon anywhere. Now, where this disease occurs, it can occur starting from the mouth up to the colon, or anywhere in between, maybe the large intestine, the small intestine, the colon itself. Now, Crohn's disease also associated with ulcerative colitis. Now, what is ulcerative colitis? Ulcerative colitis is the inflammation of only the colon. It is known as ulcerative colitis. It is known as ulcerative colitis. Now, the colon, when there is inflammation occurs in the colon, it is known as ulcerative colitis. In intestinal bowel disease, what is the symptoms of this disease? That there is abdominal pain, diarrhea, vomiting, fever, and weight loss. All these conditions associated with the loss of weight of the body. So that is abdominal pain, diarrhea, vomiting, and fever. It also associated with reddish, tender skin. Nodules means the skin becomes stiff. There is formation of the nodules on the skin. That is known as tender skin nodules. So the inflammation of the joints. There is also inflammation of the joints in the eyes and the liver. Now, how we can diagnose the intestinal bowel disease? The diagnosis of the intestinal bowel disease depends upon the certain techniques such as vibarium enema. Now, this barium enema help in the X-ray examination and detecting the abnormalities in the intestine. You know that barium is a metal. So when this barium enema is given to the patient by means of injection from the anus, that this enema may show the sites where there is inflammation occurs in the colon or in the part of the large intestine. Next to the colonoscopy means that we can take the scopic investigation by means of injection of any fluid. So there is colonoscopy. Now, treatment of this inflammatory bowel disease, that is the drugs for the suppressing inflammation or the immune system. Now, here the question arises that the immune system must be strong to inhibit the infection or any kind of inflammation. But in this case, the drugs can be used to suppress the inflammation or the immune system, because the activation of the immune system is a factor for the intestinal bowel disease. so that we can use the drug to suppress the immune system, that is suppressive of the inflammation. So these drugs are nothing but the antibiotics, and if there is no healing of this intestinal bowel disease, then the ultimate treatment is the surgery. Ultimate treatment is the surgery. Now, again, the causes of the disease. What are the causes of the disease? You know that every disease having its own causes. So, in case of this intestinal bowel syndrome, the causes of the disease, the exact cause is unknown. It has been found out that the exact cause of this intestinal bowel disease is unknown. But it has been observed, it has been found out that this disease may be due to the infection of certain bacteria. You know that in case of digestive system, usually the infection arises due to the effect of microorganisms, particularly the bacteria as Mycobacterium. The Mycobacterium is the most important bacteria which is responsible for the cause of the disease. So this disease is not contagious. This is not contagious means that it cannot be transferred from one person to another one. So it is not contagious disease. Now, activation of immune system in intestine. Now, I just told you that the drugs which are used in the treatment of intestinal bowel disease is the suppression of the immune system. So the activation of immune system in the intestine plays an important role in the intestinal bowel syndrome. So we have to use the drugs which are responsible to cause the suppression of this activated immune system. Because whenever there is action of certain bacteria in the intestine, that is in the colon or the large intestine, there is a disease arises that is known as intestinal bowel disease. So we have to suppress this immune system. During the activation of the stage of intestinal bowel disease, certain pathogens. Now pathogens, you know that these are the components, these are the antigen which enter into the body and they causes the pathogenic condition, that is there is infection, there is inflammation. So pathogens within the enteric cavity shifts to the mucosa lamina propria. Mucosa lamina propria. This is the site of the action of the microorganism and activate the immune cell. So when there is activation of the immune cell, these cells are more prone for the disorder that is known as intestinal bowel disease. So immune cells after action of antigen causes inflammation of the GIT because antigen antibody reaction takes place and they are responsible for the cause of inflammation in the gastrointestinal tract, particularly in the large intestine or the colon. Now intestinal bowel disease including Crohn's disease and ulcerative colitis is characterized by chronic intestinal inflammation due to the immune response to the microbes in the gut, which I have told you previously that it is due to the characterization of the chronic intestinal inflammation, which is due to the immune response to the microbes in the gut, Now, the abnormal activation of the immune system is genetically inherited. Right? Now, genetically inherited means it is transferred from the genes. So that's why it is genetically inherited from the parents to the offspring. So recently a gene called NOD2 has been identified. What is the name of the gene? That is NOD2, which has been identified associated with the intestinal bowel disease. It is associated with the intestinal bowel disease. Now this gene determines how the body responds to some bacterial products. Now what is NOD2? What do you mean by this NOD2? It is nucleotide binding oligomerization domain containing protein 2. That is nucleotide binding oligomerization domain containing protein 2, also known as Caspase recruitment domain. Caspase recruitment domain containing protein 15. It contains protein 15 on intestinal bowel disease protein 1. On intestinal bowel disease protein 1. It encoded by NOD2 genes located on the chromosome 16 means that this gene is responsible for encoding the chromosome that is present on chromosome 16. So on the basis of that we can find out the cause of this intestinal bowel disease. Now next is E. coli. Now E. coli again is a microorganism which plays an important role in the intestinal bowel disease, or it is a pathogen. It is a pathogen, or that causes the pathogenesis. That is the pathogenesis. Now how the Crohn's disease affects intestine? Crohn's disease impacts intestine. In early stages, this disease causes ulceration. Now ulceration means erosions in the inner surface of the bowel. Erosions means the eruption of the cells or the skin inside or the membrane in the inner surface of the bowel. With time becomes deeper and larger. So that is with prolonged time or having the more time when this ulceration occurs according to the time factor. As it becomes prolonged, it becomes deeper and larger. It becomes deeper and larger. Now, ultimately becoming two ulcer. In the beginning, it causes invasion of this microorganism. They invades themselves in the inner lining of the intestine. So when there is prolonged period takes place for their action, then automatically they causes the wounds, the presence of the wounds, and ultimately they are becoming a true ulcer. They are becoming a true ulcer. So as the disease proceeds, the bowel becomes narrowed. You know that whenever the disease occurs in the intestine, in case of intestinal bowel disorder or the disease, as the disease progressed, the bowel becomes narrowed. There is narrowing in the bowel, and this narrowing of the bowel may cause the obstruction. In the intestine. So due to this obstruction, there causes the holes in the walls of the bowel. When there is true ulceration arises, they causes the narrowing of the passage for the propagation of the food components, and then there is obstruction. This obstruction causes the appearance of the holes in the wall of the bowel, and bacteria can infect. In this case, when there is presence of the holes in the wall of the bowel, the big bacteria, it is very easy for the bacteria that they can infect the surrounding organs by spreading the infection. So they aggravate the formation of the ulceration. They aggravate the formation of the ulceration in the bowel or the intestine. This obstruction may cause certain symptoms, that is, or disorders, that is the nausea, vomiting, abdominal cramps, and abdominal distension. Because due to the obstruction, there is nausea, vomiting, abdominal cramps, and abdominal distension. When the ulcer reaches an adjacent empty space, or adjacent empty space, that is, when this ulcer reaches an adjacent empty space inside the abdominal cavity, causes abdominal abscess. Now, because due to the accumulation of this, there is arising of the abdominal abscess, and the abscess is nothing of a collection of the pus. So there is collection of the pus, and they may cause the tenderness of the abdominal masses, high fever, and the abdominal pain. So when ulcer tunnels to an adjacent organ, a channel, that is fistula, is formed. Now what is fistula? Fistula is nothing. It is a connection between the two parts of the body. In infection and inflammation, it usually arises in case of infection and inflammation, that is when ulcer tunnels to an adjacent organ, a channel fistula is formed. A channel fistula is formed. So what are the medication of this intestinal bowel disease? The medication is anti-inflammatory drugs. You know that anti-inflammatory drugs, those drugs which inhibit the inflammation. Inflammation is, you know that when there is accumulation of the fluid, it may cause the swelling or the edema, it may cause the pain, it may cause the redness, and it may cause an increase in the body temperature. So that's why to avoid this, we have to use the anti-inflammatory drugs. Anti-inflammatory drugs. Now, topical antibiotics. Topical antibiotics means the antibiotics which can apply topically. They are known as topical antibiotics. Now, immunomodulators. What do you mean by immunomodulators? I just told you that during the intestinal bowel disease, there is increase in the activity of the immune system, or immune system becomes more active. So to suppress that, we have to use the immunomodulators. Immunomodulators are those which inhibit or which suppresses the process of immune system, that is known as immunomodulator, right? Now first, anti-inflammatory drugs. The first drug is 5-amino salicylic acid, which is known as 5-ASA. 5-ASA, that is 5-amino salicylic acid. Example, sulfasalazine. Example is sulfasalazine and mesalamine. Now what is the mechanism of action of this drug? They interfere in the metabolism of arachidonic acid. Now how they, because we are discussing the anti-inflammatory drugs. Anti-inflammatory drugs means those drugs which inhibit the formation of the prostaglandins, the leukotrienes, that is, that cyclooxygenase. These are the autophytes which I have discussed in detail under the heading of autophytes. So these prostaglandins and leukotrienes are the inflammatory agents. They causes the inflammation. So we have to suppress the synthesis of this prostaglandin and leukotrienes. So what is the precursor of this prostaglandin and leukotriene? It is nothing but the arachidonic acid. So arachidonic acid, it is unsaturated fatty acid with 20 carbon, and it is the precursor for the synthesis of prostaglandin and leukotriene. So 5-amino salicylic acid interfere in the metabolism of arachidonic acid and inhibit the synthesis of prostaglandin and leukotrienes. So when there is no prostaglandin leukotrienes, there is no process of inflammation. Next is the corticosteroids. The corticosteroids, these are the steroids in nature, and they are also responsible for the inhibition of the synthesis of these prostaglandins, leukotriene, cyclooxygenase, and the other components which are responsible for the inflammation. Now, next is the topical antibiotic, that is cancer suppository. Cancer suppository is topical antibiotic. Suppository means that those drugs which can be entered into the body through the anus, they are known as suppositories. So this is cancer suppository, which is known as topical antibiotics. It enters into the intestine and it may cause the healing of the inflammation. Now after that, the antibiotics. Now antibiotics, that they can act against the microorganism, that is the bacteria which is present in the intestine, that is the bowel or the colon. These antibiotics are metronidazole, which is known as flagyl, ciprofloxacin, that is known as ciprofloxacin. So this ciprofloxacin and metronidazole, these are the antibiotics which can be used for the treatment of this intestinal bowel syndrome, right? Now topical antibiotics. There is a new class of antibiotic, topical corticosteroid. Topical corticosteroid, it can be used for the treatment of the intestinal bowel disease. Now, immunomodulators. Again, I just told you about the immunomodulators. They modulate the action of the immune system. The immune system, actually the immune system is the defensive system, or it shows the mechanism against the foreign components in the body, and that is known as immune system. And immune system is nothing but the immunoglobulin E, that is the most important component. So in case of the intestinal bowel disease, there is the activation of immune system takes place. So we have to use certain immune modulator which causes the suppression of this immune system. They affects the body immune system, composed of immune cells plus proteins. Composed of immune cell plus proteins. They protect the body from harmful bacteria. Means that they protect the body from harmful bacteria, viruses, fungi, and other foreign invaders. Invaders means those which invades themselves to the lining of the intestine, and they causes the penetration. And when there is penetration, there is presence of the holes, and that hole may be responsible for the ulceration. So activation of immune system causes inflammation within the tissue. Where the activation occurs, that is inflammation, is in fact an important mechanism I told you just now, used for immune system to defend the body. But here, when there is activation of immune system in the intestine, that is the large intestine, small the colon, then there is inflammation occurs, and it may cause the ulceration. So we have to suppress this activated immune system. Now, in patients with Crohn's disease and ulcerative colitis, the immune system is abnormally and chronically activated in the absence of any known invader. Right? Now, immune modulators decreases the tissue inflammation by reducing the immune cell population, or by interfering with their production of the proteins. So this is the mechanism of the immunomodulators. They suppresses the immune system or reducing the immune cell population, or by interfering with their production of the proteins. The immunomodulator is 6-mercaptopurine, azathioprine, methotrexate, and infliximab. So these are the drugs which are used for the suppression of the immune system, and they are known as immunomodulators. That's all about today. That is the intestinal bowel disease, its symptom, its treatment, its causes, and the mechanism of action of the different drugs to suppress this inflammation in the bowel or the intestinal bowel disease. So that's all for today. Thank you so much. So nice of you. Now that was the lecture today. That is, we have discussed about the intestinal bowel disease, or the disease of the intestine or the colon. Now again, you know that it is the part of the gastrointestinal drugs treatment. So this we have discussed today. Now next time we will discuss the emetics and anti-emetics. That is, what is the process of the emetics, how the vomiting takes place, and how we can control the vomiting, that is by using the anti-emetics. So that will be discussed tomorrow in our this lecture. Now hope that you have followed this lecture. Again, repeatedly I am saying that if you feel any difficulty in the lectures, you can contact to me either in your groups of second prof, or on my cell phone, because you are all having my cell number. So if you feel any difficulty, you can ask to me. I will explain to you all that. So thank you so much, so nice of you. So please be careful about your studies, because you are having enough time to complete your syllabi, to study your syllabi, and then it will be very easy to appear in the examination with full preparation. Now thank you so much, so nice of you.